High blood pressure, or hypertension, is often called the silent killer for a reason. It typically shows no obvious symptoms, yet it significantly raises the risk of heart attack, stroke, kidney failure, and other serious health problems. For adults over 60, managing blood pressure becomes even more critical. Fortunately, research now points to a surprisingly simple solution that requires only 5 minutes a day, and it could dramatically improve cardiovascular health. Let's explore this habit, how it works, and why it's such a powerful tool for heart health after 60. The problem: high blood pressure and aging. As we age, our blood vessels naturally become stiffer. This leads to increased resistance in the arteries and higher blood pressure. Over time, high blood pressure forces the heart to work harder, increasing the risk of heart attacks and other cardiovascular events. What's more concerning is that many people over 60 either don't realize they have high blood pressure or rely solely on medications, which may not address the root cause. While medication is sometimes necessary, lifestyle interventions, especially simple, sustainable ones, can be incredibly effective. The 5-minute habit: isometric breathing exercise, inspiratory muscle strength training, IMST. The daily habit: gaining attention is a form of isometric breathing called inspiratory muscle strength training, or IMST. IMST involves inhaling through a handheld device that creates resistance, strengthening the muscles used to breathe, especially the diaphragm and intercostal muscles. But the benefits go beyond just lung function. In clinical trials, older adults who practiced IMST for just 5 minutes a day, 6 days a week, for 6 weeks, saw significant reductions in both systolic and diastolic blood pressure, rivaling the effects of some blood pressure medications. How to perform: it uses a high-resistance breathing device. These devices are inexpensive and available online or through physical therapy centers. Popular models include the Power Breathe or the Praro 2Fit. Sit upright and relax. Sit in a comfortable chair with your feet flat on the ground. Inhale against resistance. Take a slow, deep breath through the device until your lungs are full. The resistance will make this feel like lifting weights with your breath. Exhale. Normally, breathe out without resistance. Then repeat. Repeat for 30 breaths. This typically takes about 5 minutes total. That's it. No gym, no sweat, no major time commitment. Why it works. The key mechanism behind IMST's success lies in its effects on the autonomic nervous system and the endothelial function of blood vessels. Improved vascular function. IMST enhances the flexibility of blood vessels, improving blood flow and reducing pressure inside the arteries. Reduced sympathetic nervous system activity. It helps calm the body's fight or flight response, which can contribute to high blood pressure. Enhanced nitric oxide production. This helps arteries relax and expand, allowing for smoother blood flow. The research, a groundbreaking 2021 study published in the Journal of the American Heart Association, showed that older adults using IMST reduced their systolic blood pressure by an average of 9 points, a reduction comparable to what's seen with standard medications. Even more compelling, these benefits lasted for weeks after participants stopped using the device, suggesting a lasting impact on cardiovascular health. Additional benefits besides lowering blood pressure, IMST offers other perks. Improved breathing efficiency and oxygen delivery, enhanced endurance and exercise performance, potential improvements in cognitive function due to better blood flow to the brain, reduced inflammation. Another major risk factor for heart disease, who should use it. This habit is ideal for adults over 60 looking to improve or maintain heart health. Those who struggle with traditional exercise routines, people already on blood pressure medications, who want to explore complementary methods, anyone looking for a fast, evidence-based way to boost vascular health. However, it's always wise to consult with your healthcare provider before beginning a new exercise or breathing routine, especially if you have chronic conditions or respiratory issues. It's easy to assume that better health must come from dramatic changes or time-consuming routines, but sometimes the most powerful habits are the simplest. Just 5 minutes a day of focused breathing with a small device can strengthen your lungs, relax your arteries, and significantly reduce the risk of heart disease. For those over 60, this small commitment could lead to longer, healthier, and more independent years. So why not try it? A few minutes a day could change your heart's future. Incorporating this habit into your daily routine can be incredibly simple, even if you're new to structured health practices. In fact, many people find it easier to stay consistent with IMST than with traditional exercise programs, which can be physically demanding, time-consuming, or difficult to maintain as we age. How to build it into your routine. The key to success with any new habit, even one that takes only 5 minutes, is consistency. Here are some practical tips to help integrate IMST into your lifestyle. Choose a fixed time daily. Link the habit to something you already do regularly. Many people find it effective to do it right after brushing their teeth in the morning or during their morning coffee. Creating this anchor helps build a sustainable routine. Set a reminder, whether it's a sticky note on your bathroom mirror, a smartphone alarm, or a habit tracking app. A daily prompt can ensure you don't forget. Track your progress. Logging your sessions in a notebook or on a health app can provide motivation. Over time, you may begin to notice additional benefits such as improved energy, better sleep, or less breathlessness during physical activity. Start slow, if needed. If using full resistance feels challenging at first, most IMST devices allow you to adjust the difficulty level. Start at a lower resistance and gradually build up as your inspiratory muscles strengthen. Make it enjoyable. Sit by a window, listen to calming music, or practice IMST during a quiet moment of reflection. Turning it into a pleasant ritual increases the likelihood of long-term adherence. Safety considerations. Although IMST is generally safe for most people, especially when performed properly, there are some precautions to keep in mind. Individuals with severe respiratory disorders like advanced COPD or uncontrolled asthma should consult a physician before beginning IMST. If you experience dizziness, chest pain, or shortness of breath during or after sessions, stop immediately and speak to a healthcare provider. Make sure you're using a well-calibrated and clean device to avoid infection or inaccurate resistance settings. Complementary lifestyle changes. While IMST alone is powerful, it becomes even more effective when combined with other heart-healthy habits. Consider adding these supportive practices. Eat for heart health. Focus on a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats like those found in olive oil, avocados, and fish. The DASH, dietary approaches to stop hypertension. Diet is particularly effective for managing blood pressure. Stay physically active. Even moderate activity like brisk walking, swimming, or gardening for 30 minutes a day can have a significant effect on cardiovascular health. IMST can complement these activities, especially on days when full workouts aren't feasible. Manage stress. Chronic stress raises cortisol levels, which can lead to elevated blood pressure over time. Practices such as meditation, deep breathing, Tai Chi, and yoga are helpful, and IMST itself can have a calming, meditative effect. Get quality. Sleep apnea and poor quality sleep can raise blood pressure and increase heart disease risk. If you snore heavily or feel fatigued during the day, talk to your doctor about a sleep study. IMST has shown potential in improving respiratory muscle tone, which may benefit people with mild sleep-disordered breathing. Testimonials and real-world results. Many people over 60 who have incorporated IMST into their routines report life-changing improvements. Some note they were able to reduce their medication doses under doctor supervision. Others share stories of regaining stamina, breathing more easily during walks, or even returning to activities they had once abandoned. For example, Linda, a 68-year-old retired teacher from Arizona, began IMST after reading about it in a medical newsletter. Within 2 months, her systolic blood pressure dropped from 142 to 128. More importantly, she felt calmer, less winded during daily walks, and more in control of her health. What to look for in an IMST device when choosing a device? Look for one with adjustable resistance settings, clear instructions, and a comfortable mouthpiece. Durable design and easy-to-clean parts, a size and shape that suits your needs for portability or home use. Avoid cheap imitations or devices not intended for inspiratory training. If in doubt, consult your doctor or a respiratory therapist for guidance. Looking ahead, as research into IMST and other micro-exercises continues to grow, we may begin to rethink how we define fitness and heart health. It's no longer about extreme workouts or drastic lifestyle changes. It's about doing small, consistent actions that deliver real biological benefits. For people over 60, this shift is empowering. It means that even with physical limitations or a busy schedule, you can still take meaningful steps every day to protect your heart and overall well-being. Conclusion: in just 5 minutes a day, you can adopt a science-backed, accessible habit that strengthens your lungs, relaxes your blood vessels, lowers your blood pressure, and reduces your risk of heart attack. This isn't a fad, nor is it an empty promise. It's a clinically supported method with tangible results, and it's within reach for almost anyone. The choice is simple. Continue down the path of passive health management, or take 5 minutes a day to actively invest in your heart, your independence, and your future. No matter your age, your health journey can begin or continue with a single breath.